dreams, often working with patients who struggle with nightmares. He is a California native, went to college in Chicago, volunteered in Israel, got a PhD from the University of Wyoming, and then did an internship year in Albuquerque. In 2013, he began a postdoctoral fellowship at the UT Health Science Center right here in San Antonio. And if you live in Monte Vista, you might have seen him and his wife walking their greyhound, Sophia. Please welcome clinical psychologist Jeremy Joseph!
Before I start, you really can't see anything with the light blinding you. Before I start, I just want to say a couple of thank yous. All right, thanks. So, thank you to the rain for falling and then stopping for the night. Thanks to the grackles up in the trees. I want to thank Vicki and Nicolette, who sent a lot of emails to all the speakers and were really helpful. I want to thank our MCs, Beamer and Cox. I also want to acknowledge the indigenous people of South Texas, the Coahuiltecans, whose traditional lands we are standing on tonight. So, I had fun drawing all of these slides just for Pecha Kucha, so I hope you enjoy them. If you do like them, then thank my wife, because she's the one who bought me the drawing tablet. Dreams are mental events that take place in our brains starting around 3 years of age. Everyone has about 4 dreams each night, whether you remember them or not. This could just be random noise as the brain goes about doing its job while we sleep, but it's a noise that we each react to in our own unique ways. Dreams happen mostly during REM sleep, REM. Electrical impulses in the brainstem travel to regions that control attention, motivation, visual processing, and memory formation. The base of the brain also sends signals to the spinal cord that cause temporary paralysis. Without those signals, we would sleepwalk when we dream. Dreams often feel like reality when we have them, even when impossible things happen. This is an active area of research, but it looks like dreams help us consolidate memories and process our emotions. It also looks like dreams keep the brain activated so that it will be prepared to process new sensory information when we're awake. Nightmares are simply dreams that turn upsetting. Nightmares aren't different from dreams, they just cause us to feel strong emotions like panic or sadness. This can interrupt the sleep cycle by waking us up suddenly, so nightmares can become a health problem because rest is essential for cell restoration and mental focus. All right, dreams are nice, but there's more to my story. I specialize in the treatment of PTSD, and nightmares often come up in the work I do at UT Health Science Center. After something painful or disturbing happens, PTSD can develop. Nightmares are a hallmark symptom of PTSD, along with avoidance and hyperarousal. So with PTSD, that fight, flight, freeze response we all have is triggered more easily. It's like a guard dog in the nervous system, designed to protect its owner from harm. After something awful happens, that guard dog learns to react faster. When you have a nightmare, all it knows is that something feels wrong, so it starts to bark until you wake up. It might help to think of PTSD like watching a scary movie. The actors and the special effects on screen aren't dangerous, but because of the images and the sounds in the dark theater, audiences still scream and jump out of their seats. It's because their guard dog is getting sensory information that mimics a real-life threat. Having PTSD feels like you're stuck in a tense thriller instead of the romantic dramedy that life is. Friends might try to convince you that you're safe, but your guard dog is stuck in crisis mode. Since nightmares can feel so real, they trick your guard dog into believing that a trauma from the past just happened again while you were sleeping. So we have to get sleep to live. Avoiding dreams by staying up late or drinking alcohol to pass out are not viable options. So how do we treat nightmares? You could try an alpha blocker like prazosin or clonidine, originally developed to treat high blood pressure. They dampen norepinephrine effects, which is like blocking an adrenaline rush. This makes sense because your guard dog won't wake up without the chemical that triggers fight, flight, freeze, but it's not like we have something that can actually erase a specific memory or block out a thought that you want to stop thinking about. There's also the risk of side effects, and nightmares can return as soon as you stop taking either drug. How about talk therapy to work with nightmares? I'm trained in cognitive behavioral therapy, or CBT. CBT uses standardized treatments that work by changing the thoughts and behaviors that cause or maintain distress. We can't control every event that happens to us, so CBT helps people develop healthy habits that can make a lasting difference. The best supported CBT approaches for treating nightmares are imagery rescripting therapy or something called exposure, relaxation, and rescripting therapy. First, you write out your nightmare, and then you change the story so it ends well. And reading the safer version to yourself every night can train your mind to have the rewritten, unscary nightmare. Studies have shown this can reduce distress. However, it lumps nightmares into the same category as problematic thoughts like black and white thinking or jumping to conclusions. I disagree that nightmares are a problem to be changed. Instead, we can change how we relate to our nightmares so that we aren't upset by them. Think of dreams like x-rays. X-rays into our thoughts and feelings. X-ray images look strange if you don't know how to read them, but if you understand them, they offer a lot of important information about what's going on inside you. Our dreams also offer us rich information about what's going on inside ourselves if we know how to look at them. So that brings me to the Gestalt School of Psychology. And as I said, my training is mainly in CBT, but I know a bit about Gestalt. And one of the main themes is that the brain takes sensory experiences and integrates that information into something greater than the sum of its parts. So looking at these 2D shapes, your mind might construct a 3D image. Gestalt has a therapy approach called the two-chair technique to resolve internal conflict. First, you identify what your clashing opinions are, and then you take the perspective of each side by moving actually between the two chairs and allowing these two sides of yourself to talk. By creating communication in yourself, and Tom Cruise, you create resolution and self-awareness. Gestalt frames dreaming as a way for our minds to work through thoughts, memories, and feelings. Every element in a dream is understood to be a stand-in for some part of yourself. Gestalt dream work makes contact with these aspects of ourselves, identifies why they matter, attends to the concern, and then unites any fractured parts of the self. And the process is pretty straightforward. You go through the events of the dream, noticing all the elements and transitions between scenes. Using open-ended questions, you identify the actor and the action in order to clarify what they're there to help you figure out. So even the scary people or monsters will still have something helpful to tell you. By understanding our dreams, we come to a better understanding of how we think about the world around us, what we care about, and how we try to cope with issues in our lives. But this method was originally designed to help people understand themselves, so we need to research how well this approach actually works as a treatment for nightmares. I would love to do a randomized, controlled study looking at this question. I think that the mindfulness community would also embrace this approach. But here's a parting thought. Fighting with our nightmares is a no-win situation. That's just fighting with ourselves. When we open up to our dreams and try to understand them, we open the door to understanding ourselves.